We often talk about people, places, and things being fundamental to avoiding temptation. With family situations, that can certainly be very challenging, particularly if family members are using or are triggers for the person to use. We recommend avoiding situations as much as possible, or having sober supports. People that are in recovery, that's an important part of how 12-step programs work, is the peer support and having sober people that are helping the person to stay away from the substances. So there may be situations where people would need to stay away from family or have very limited contact and lean more on their sober support system, particularly the 12-step programs, AA, NA, and such. It can be really hard to avoid family because part of the emotional part of the holidays is wanting to be with people, and people can have really mixed feelings about knowing cognitively that they're putting themselves at risk and knowing that it isn't really in their best interest to be putting themselves in situations like that. And sometimes, unfortunately, it may mean very little or no contact with people that you would really want to see at the holidays. For a lot of reasons, people can have an exacerbation of depression or mood episodes at the holidays, and that can relate to conflict in the family, feelings of loss. That's where accessing mental health services can be very necessary and very appropriate. There are various treatments available. Large family, there's medication and counseling. Sometimes if someone has a severe depression, they may need a medication, or if it's milder or they're able to talk through it, counseling is available. There are different kinds of counseling available. There's individual counseling. There are structured sorts of therapy such as EMDR and cognitive behavioral therapy. So there are a lot of different sorts of treatments that are available in the mental health arena. And again, just like the substance use, associating with people that you know aren't going to pull you down is a good idea for depression and mood issues as well, but again can create a lot of mixed feelings because people want to be with people that they know aren't necessarily the best influences on them, which creates a lot of challenges at the holidays. Being involved in the 12-step recovery program, you'll get a sponsor, and a sponsor is someone you can talk to anytime, 24/7. You can dial the phone and call them or text them, and that's probably one of the most powerful interventions in terms of keeping you safe at the moment when you're really tempted. But the other thing is knowing your limitations. If you have to leave a family event, it's probably safer to leave the family event and get the windfall from the family related to that than it is to put your sobriety at risk. People think they should be with their family out of commitment and loyalty to the family and put themselves at risk without realizing that they have to put their sobriety first, and sometimes that means not being there for certain family members because it's just too risky. It's just too early in terms of their recovery to be able to do that. Another common theme in the recovery community is having your created family, people that you will spend those special days with when you know that you can't be with your biologic family. That is something that can be very helpful. Again, leaning on the support of people that are grounded in recovery to be there for you when other folks aren't necessarily a great exposure. Typically, people would come for an initial assessment where they would see a therapist and sort of start from the top and go through their whole history. From that appointment, they would get referred to other services that they need, whether it be individual counseling, medication management. We have both of those services available for children and adults. In counseling, the first several appointments are usually essentially background gathering, just really getting to know the person before really moving into the work of the therapy per se. There are different types of therapy available. There's individual counseling, which is, I think, what most people think of about talking to a therapist. It's just essentially sitting and talking about how things are going. Then there are more structured kinds of therapy, one of which is cognitive behavioral therapy, which is much more pencil and paper. People will tend to have homework to do between appointments. And the other therapy, which has been a big part of what we do at Signature, is EMDR, eye movement, desensitization, and realignment. And that's a particularly helpful therapy for post-traumatic stress disorder. It's an interesting therapy because it's essentially a non-verbal cognitive therapy. People will talk about trauma and things they've been through while they're experiencing sensory input. It's typically done with buzzer browsers that they hold in their hands. This reprocessing of how information is handled can make a huge difference in symptoms, even though it isn't specifically a talk therapy based on the symptoms. Again, that's really helpful in post-traumatic stress disorder. People who do well with cognitive behavioral therapy are typically people who are anxious, people who are very stuck in their thought process, and they need to break out of that and be able to process things a little bit differently and kind of look at how they interact with the world and put a wedge in there and not interact with the world in the same way. Cognitive therapy sounds too simple to really do much, but it's actually one of the kinds of therapy which has been shown with a rigorous scientific method to actually make a big difference. It's more effective than you might think based on how simple it sounds. There's a family therapy component to the medication-assisted treatment program. There are family groups that happen, and as a person goes through IOP, we want them to bring in a family member twice during the course of the IOP so that the family member can be educated, so the family member can show their support. But that often is a real challenge for people to be able to bring family members in, because a lot of times when they've gotten to that point in their addiction, the family's sort of burnt out, kind of done, and so it can be challenging for them to find someone who's willing and able to come with them to the family sessions. Family therapy is done as a huge part of child psychiatry. When a therapist or a psychiatrist is working with a kid, a large part of what you're doing is working with the parent and helping them with their parenting skills, helping them change how they act toward the child, which can probably make more impact on the behavior, a lot of times more than working with the child themselves. The important thing to remember is that recovery works. It's something that, despite a lot of people struggling with addiction, they can get better. Life can get better. We want people to know that when you need help now, Signature Health is here for you.